couldn't do it without her. She is the most important person in my work every day. So thank you. I want to thank God for having the opportunity to come back and see you again this year. And I want to repeat Sandra's thoughts about your bishop and your first lady. You may not realize how innovative and unique the leadership of this church is, but there are many people who will go through this week who will not take time to talk about the unique needs of women. So I congratulate your congregation for its genius leadership. I also want to bring you greetings from my pastor, Dr. Sir Walter Lee Mack Jr., and my First Lady Kim Mack. So we'll get started with the presentation. And so today I want to talk about the recipe for spiritual woman's health. It will include love, laughter, happiness, and then some very important things that you will need to know. So I have to tell you a little story. My husband's here in the audience, and we flew out to San Diego to meet my dad, and he's a very traditional man, and he wanted to ask my father for my hand. And my father had a couple of questions for him. He said, "You know, she works all the time." And he said, "Yes, sir." "And you know she can't cook." He said, "Yes, sir." And he said, "Are you going to have her calling my house crying about either one of those two things?" And he said, "No, sir." And he goes, and I think at some point he said, "Then you have my permission." I was still stuck on the fact that he knew I couldn't cook. So I started buying lots of cookbooks and trying to prepare to be the best wife and the best cook I could be. And I think it got better. Got better. All right. He says yes, it got better. But one of the things that's really important to know is you can go, if any of you cook, you can go into a kitchen and you can have a recipe, but when it's really good, it's a sprinkle of this and a dash of this, and it's not exactly the same. And when people try to repeat what you've done, they can't get it right because it's not just the recipe. That's true for dinner, but it's even more true for medicine, and it's even more true for women in medicine. And the reason is that women have very unique medical needs. They present very differently with symptoms and signs for diseases. They experience certain diseases more often than men, and people don't realize that. And then lastly, and this is my favorite phrase, women are not small men. And so what has happened in the history of medicine is that most of research has been done with men, and then they've just sort of tried to half the dose or apply it to women, and it doesn't really work that way because we are all ages, all races, and we have unique hormones that make us different from the studies that have been done around medicine in the past. So that's where having a center that is designed uniquely for women becomes very important. And so what I wanted to do when we built the Maya Angelou Center was begin to put out that public awareness that people could understand why it is that we need to focus on women. And so for just a few minutes, I want to share with you a little bit about what makes us unique. So there are a lot of things that are different about women. So when I first approached Novant Health and I said, we need to revolutionize women's health, they listened. And I began to share with them why it was important that we revolutionize women's health. The first is women live longer, but they don't live as well. And so we outlive men, but the last 5 to 10 years of our lives are often spent in a very frail state, sometimes bedbound, needing other people. Women receive a smaller portion of the healthcare resources put forward for research. And so many times when we're taking medicines, we're not even sure if it's the kind of medicine or the dose that we need as women. Women's health is often focused on what we say are babies, breasts, and bones. Women's health is always about delivering babies, breast disease, gynecologic disease, but it's much more than that. Women have very unique needs and changes for all types of medical issues. This is one of the saddest facts that I discovered when I began to look at women's health. When we surveyed women 18 years and over, 14% of them said that they felt like they were in poor health. This was young women needing to feel better about their health. And so absolutely we needed to revolutionize care. So I started off by saying we're going to talk about the recipe. And so love is a very important part of the recipe. C.S. Lewis, a Christian philosopher, has often described different types of love, and they range from friendship to familiarity to romantic love to what I always think of as the kind of love that God has for me, agape love, an unconditional love. But the one thing that I thought he missed, he included love of God, love for others, love of others, but he really didn't talk about love for yourself. And for women, this is really critical. As you begin to look at the literature, Dove had a campaign about reality of beauty, and the Girl Scouts of America went out and talked to young girls about what made them feel good, what made them feel sad, what made them feel healthy. And it became very clear that women and girls have very poor self-esteem in the United States. And there are many reasons for it, and I won't list all of them or read them, but I want to share with you the ones that I thought were the most striking. A girl is bullied every 7 minutes, somewhere in the United States on a schoolyard, playground, stairwell, classroom, or bathroom. Every 15 seconds in the United States, a woman is battered. 1 in 3 girls have a serious relationship, and they say that they're concerned about being brutally injured by a partner. Not women, young girls. 1 out of 4 college women have an eating disorder. Girls are more likely than boys to become victims of cyberbullying. So now that we've got Facebook and Twitter and the internet, kids are being mean to each other, and they're being mean mostly to girls instead of to boys. And it's not just the boys being mean to the girls, but it's girls being mean to girls. Suicide is the 3rd leading cause of death in adolescence, but girls are much more likely to attempt suicide than boys. And this is the one that struck me the most. Only 2% of women actually think they're beautiful. And so while I'm glad we have a Maya Angelou Center, I am really glad we have church. Our women and our girls need to go to a place where they can understand how we define beauty. And I will talk a little bit more about why that is so important, that you would have self-esteem, that you would want to be healthy, that you would even think that you deserve to be healthy. There are women and girls who don't believe they deserve to have good health care, or that they deserve to feel better than they do today. Happiness. We all know that there's times to be sad and there's times to be happy. But one of the things that I try to talk to my patients about, and I start as soon as they start waking up in the intensive care unit, because I know that being differently abled is going to give them a really hard time to transition back to home. But you need to be happy where you are. Whether you're working one arm or both arms or both legs, you need to understand that you are blessed by God and that you are a miracle. There's something called a subarachnoid hemorrhage, which is one of the worst strokes you can have. 50% of people die in the field before the ambulance even gets there. So when my patient wakes up, I say, you are blessed. No matter what's happening now, no matter what you can do, no matter what you can't do, you're blessed. And then I start to talk to them about creating a plan for happiness. And this is something that women and girls tend to have the most trouble with. They can't always see past where they are. They're multitasking, there's so much going on, the relationships aren't going well, the kids aren't doing this. And so I always start to talk particularly to the women patients about creating a plan for happiness. I haven't even started talking about cholesterol and blood pressure, because this is the important stuff. If you're not happy, if you don't have self-esteem, I can give you all of the recipe for the rest of it, but if you don't take it and own it and become accountable for yourself, then that doesn't work. Knowledge and awareness, knowing the right thing. So I have a lot of patients who got their medical degree online. They share with me what they know more than I do about their health and about their medications. And sometimes I learn from my patients. A lot of times I learn from my patients. But often they go to places on the internet or go to friends in the community and they get information from the wrong places. So one of the most important ingredients to your health is being sure that you are a student of your own health and that you get information from accurate sources. And then the last, I've learned that if you want to make something a little bit sweet but not too fattening, you can add a little bit of preserves and it goes a long way. That's a really important part to the recipe of being healthy. Dr. Maya Angelou once said, "The wisest thing I can do is to be on my side, my own side, be an advocate for myself and for others like me. If I do that well enough, I'll be able to look after someone else, the elderly, the husband, the children. But I have to take care of myself first." Some people think that's selfish, but I think it's being self-full. That is what women and girls have to learn. It's how to preserve a little bit for yourself, to be sure that you're taking your medicine and not just everyone else around you taking your medicine, that you're going to your doctor's appointments and not just everyone else going to their doctor's appointment. And so another important ingredient is preserving yourself. So what are we preserving ourselves against, and what are we trying to make a plan for? The number one enemy for women is cardiovascular disease. And so whenever I travel, I have some of the same slides, because no matter how often I do this talk, no matter how often I share this with people, I always find people in the audience that don't understand that they are at risk for heart attack and for stroke. Every time, I've been doing this for a decade, I moved here in 2003. Every time we go back and survey the community, we ask them, do you believe you're at risk for stroke or heart attack? Most of the time, nearly 70% of people say they don't believe so. But that same number, that same percent of people usually have 2, 3, or 4 risk factors. And so again, understanding the enemy is going to be one of our key goals today. So heart disease is the #1 killer in the United States. More than 1/4 of all deaths that happen for women come from heart disease. This is what's interesting. Remember, I talked about self-esteem. I don't understand this, but most women will not call 911. And it's when they know that there's something really wrong. I don't know if it's because they're busy doing other things, or if they don't think that they want to pester someone, or they're not really sure because the symptoms are a little bit different, but they don't call 911. And here's the challenge, because after you call 911, women tend to get slower care than men because they present uniquely. So they wait to call 911, and then once that happens, their care is even further delayed. And when you're talking about the brain, for every minute that the brain doesn't get what it's supposed to have, 1.9 million brain cells die every minute you're waiting to call 911 if you think you're having a stroke. Cardiovascular disease kills 6 times as many women as breast cancer every year. And I'll be the first to tell you, if the yogurt has a pink ribbon on it and one doesn't, I'm more likely to buy the one with the pink ribbon. I strongly believe that we need to continue to do research to stomp out breast cancer. But it is not the #1 killer of women. And we need to continue to pour funds into doing research for cardiovascular disease for women as well. I want to share a little story with you about the misunderstood and the multitasking. Maybe not. Let me tell you about the story about the misunderstood and the multitasking. So the American Heart Association and American Stroke Association created a public service announcement, and it is with a woman who's in her 30s, and there are children all over the kitchen. She's trying to cut the bread just right. She's trying to get the crust off the bread the way the kids like it. She's coming out of her jacket. She has pain in her jaw, and her son says to her, "Are you okay?" She starts fanning herself. The kids are screaming. The plates are breaking. She bumps into the refrigerator, and she just can't get her thoughts together. And her son says, and he's this big, "Mom, I think you're having a heart attack." And she says, "Do I look like someone that would be having a heart attack?" And it's interesting because I think in her mind at 35 years old, she wouldn't be having a heart attack. And then the public announcement ends with her on the floor. And she's calling 911. So it had to get that bad to get to the floor. She's calling 911, and she says to 911, "I think I may be having a heart attack. I'm really sorry to bother you." And that's one of the strongest moments in the public service announcement, because that is really what women do. They don't want to bother anyone, even if they believe that they're having very significant symptoms. Go back to the next slide. So let's talk about why men get there before women do. And so what usually happens is that men get warning. Not all the time, but a lot of times men will have up to 6 hours worth of symptoms before the heart vessels begin to collapse. Women may have nausea, they may have vomiting, they may have dizziness, they may have shortness of breath, but they don't often have chest pain. And so that discussion of someone standing on your chest or the pain going into your jaw or your arm, often women don't experience that. Sometimes what they experience is really silent heart attacks. And so the next thing they know is that they've collapsed on the floor. Men can experience numbness and cramping the same way women can, but it tends to be more left-sided. Women tend to get it in the back of their necks or in their shoulder blades. And so a lot of times it's misunderstood as being something that's just a muscle spasm. So there's lots of public awareness campaigns like that one out, but there still is a lot of work that needs to be done. 38% of women will die in 1 year after a heart attack, in comparison to 20% of men. 64% of women who died suddenly from heart disease had no previous symptoms, in comparison to 50% in men. And then what's interesting is a lot of these things, 75% of strokes and heart attacks are preventable. And if we have the education, we can prevent them. But for some reason that isn't clear, it could be because women's symptoms are unique. Often women get very poor education when they're in their hospitals about how to prevent the next event. So we live in something called the stroke belt. In 2 areas of the country, the Northwest Pacific and then where we live. In the area that we live in, we have an increased risk of having a stroke. And if we're going to have a stroke, we have an increased risk of dying from stroke. That's men and women. And so if you relocate from one area of the country to this country, your risk goes up. Millions of dollars are being spent to try to understand why that is. So even if you have a similar family history to people in the North, you have similar eating habits to people in the North, there's something unique about this area. And they think some of it has to do with the way that food is prepared, but it's multifactorial. Women in stroke, it's very interesting. So about 400,000 women will have a stroke each year, about 50,000 more than men. More women will die. They will have significantly more experience with stroke because they're more often caregivers. So they're at risk for having stroke, but they're also at risk for being caregivers and having the stress of taking care of someone who's differently abled after a stroke. And African American women are significantly higher risk from dying from stroke than their Caucasian counterparts. 100,000 of those 400,000 women will be young women in their middle ages. Most people think that stroke is of the senior aging population, but actually a third of patients who will have stroke will be under 65 years old if they're women. Stroke is the leading cause of disability, so under 65 means you're not on Social Security yet. You're probably still trying to work if you can, so you're at the height of your career, potentially, when all of a sudden you become disabled. I had a boardroom full of people, and I asked everyone to give me their keys. And I said, if I were to take your keys away and tell you you can no longer drive because you just had a stroke, try to figure out how you'd get through the rest of your week. And all of them couldn't. They had people to see, they had meetings to go to, kids to pick up, just something as simple as not being allowed to drive after stroke. There are big age milestones related to stroke for women. One is that in the early stages of life, when you're still in your reproductive years, you're at very high risk for having stroke. Most women don't realize that. And then, after 55, for every decade we live, the risk for having a stroke doubles for women. One of the things that's important to know is people often think that it's the pregnancy itself that puts you at risk. And they often miss one of the very important things that I want to share with women and their families. After you deliver the baby, that time is called the postpartum time. If you look up here on the screen, you will see that that is the time when women are at the highest risk for stroke. What I've seen happen is they think that they're tired because the baby's been up all night, or they're slurring their words because they haven't had enough sleep. And as it turns out, they're having a stroke, but they miss the signs and symptoms because they assume it's because of something else. So if you have someone who's in your family that's just delivered a baby and they're in that 6 weeks after delivery, and they have symptoms where their arm is weak or their leg is weak, they're having trouble talking, they're having trouble getting their thoughts out, they're saying they can't see well, their balance is off, consider the possibility that even though she's young, she may be having a stroke. People always say, well, what you don't know can't hurt you. In medicine, that's the one time when it really isn't true. Stroke kills twice as many women as breast cancer. And when we ask women what they're the most afraid of, they're the most afraid of breast cancer. They don't understand that they're at risk for having stroke. Want to try this one? Yay.
On this particular day that I had my stroke, it was one of the first few days I had with this guy, and I was single and I hadn't had any really good dates in a while, but I was very anxious. I had a new outfit, I wanted to look cute, I wanted everything to go right, so I took my anxiety as being just that and not a stroke. I started perspiring, which is not cute at all when you're out on a date with a guy. And so I'm patting my brow. This pain, it felt like not only did someone have a ton of bricks on my chest, but it felt like somebody had my heart in their hand. I was so scared. I was scared and anxious at the same time. I was completely ignorant to what was going on. I didn't understand it. At that point, I really couldn't talk. It felt like my lips were 50 pounds each. When we got into the hospital, the nurse fussed at me for not taking my blood pressure medicine, and I had not had hypertension or high blood pressure prior to that day. I had no knowledge of it. They ran a series of stress tests, and my family came in to visit me, and that's when I got knowledge that not only was stroke part of my family history, so was high blood pressure in both parents, and I'm the youngest of 9. You have to be knowledgeable about what you're doing each day. I'm gonna tell more than 5. My 4 sisters and my 2 best friends. The guy that took me out on the date a year later, since we didn't get to have dinner that night, took me out to the same restaurant, and later that night he actually proposed to me, and we've been married 7 years now. I'm Charmaine, and I go red for all the women in my family.
So what you might not have been able to hear, she's on their first date. And I love this one because it reminds me of my first date with my husband. He walked up and I said, this is the one. And if I was sitting there and I started having symptoms, I probably wouldn't have gone anywhere either because, I was over 40 and I had finally found the one. But what she says is she had chest pain. And that's a problem because most people think of chest pain as heart attack. And so women are very unique. One of the common things that they do is they present with hiccups. They could present with chest pain, nausea, general weakness instead of just weakness on one side of the body. shortness of breath, palpitations. And what the challenge is that sometimes that you heard her say they did some stress tests on me. Well, that's what we do for heart patients. So we go down the path of looking for other things like heart disease, when in fact the problem that you're having isn't heart disease at all, it's stroke. And so women presenting differently can sometimes cause delays in the type of appropriate care that you get. One of the things that I think is striking is that most of the time the public doesn't really know what a hospital or group of physicians are capable of doing. And so it's very important to understand what I call the black eyes on American stroke care. And so women and African American stroke patients tend to get less preventive care for subsequent strokes than what they're supposed to have, even if they have insurance. Survivors who have stroke, about a third of them within 5 years are going to have another stroke, and many of those strokes are preventable. But it requires that you take certain medications. And when we go across the country, we look at hospitals and survey their charts and see if they gave the right instructions to patients. We found out that women rarely get complete instructions. African Americans rarely get complete instructions. And so it is important that people know what they're supposed to get when they're leaving the hospital and be basically stewards for their own care. And then there are important medications like blood thinners that we are supposed to have as women and men, but particularly women do not get complete information about those types of medications. And so I think the best thing to do is just not have a stroke and a heart attack to begin with. And so what we have to do is talk about how do we prevent it? How do we actually get ahead of the enemy? And so I like this little cartoon because basically people don't understand that smoking can actually increase your blood pressure. Decreasing smoking can actually decrease your blood pressure. Exercising can help with your blood pressure or with your cholesterol. All of these things are really interconnected together. And so the things that are bad for the heart are bad for the brain. And we want to talk about very specific things around your cholesterol, your blood pressure, and your sugar. The reason for it is more than 50% of women after the age of 55 will experience high blood pressure. That's a pretty high number. That's over half of women by the time they're 55 and older will have high blood pressure. After 45, twice as many women as men will develop diabetes. And it's not really rocket science. It's the same stuff you always hear about: cholesterol, high blood pressure, diabetes, the things that we actually call modifiable risk factors, things that we can control ourselves. So let's talk about blood pressure, because I think this is the catch. I often ask people, do you have high blood pressure? Many times they say no, we find out otherwise. If they have high blood pressure, I say, is it well controlled? And they say yes. And then I say, tell me the number. And they'll say, well, sometimes the top number is 170, sometimes the top number is 160, sometimes the top number is 180. And I say, is it sometimes ever 120? No, not usually 120, because that's too low. I think that when my blood pressure is 120, that's going to make me sick. They don't understand that actually when they have normal blood pressure, they're much more likely to be well and stay well. So fighting high blood pressure means knowing what the cutoffs are. And so normal is less than 120. So I won't ask you to raise your hand if you have high blood pressure. And out of those people, how many of you tend to be less than 120? But there's probably not going to be a whole lot of hands in the audience. Prehypertension is a category between 120 and 139, talking about the top number. High blood pressure, stage 1, according to recommendations for blood pressure by the American Heart Association, 140 to 159. And each of these levels has a correct level for the bottom number also. Then there's stage 2, where you need to be on more medications, 160 or higher. And then the 180 that a lot of my patients feel comfortable with is actually an emergency. I mean, you need to be seeking medical attention at 180. And they're telling me that they have just a touch of high blood pressure. It's kind of like having just a touch of pregnancy. There is no such thing, okay? Especially when you're African American and you are at such high risk for having stroke and heart attack. Now remember, there's no such thing as a perfect recipe in a cookbook. And so it really varies depending on what your family history is, what your other risk factors are, what our goals are for your cholesterol. But in general, the total cholesterol should be less than 200. When we talk about the good cholesterol and the bad cholesterol, you have to kind of partner with your doctor, because depending on how many other risk factors you have, we may need to be very, very strict about your good cholesterol and your bad cholesterol. And so one of the things to do is not jot down these numbers, but just go to the doctor and say, based on me, my blood pressure, my family history, my diabetes, and my risk factors, what should my cholesterol be? And then what are we going to do to attain that cholesterol together in partnership? Diabetes. This is the one thing that I hope I can see decrease over the course of my career, because it is for certain one of the biggest killers of the African American patient population. In general, across the United States, 25.8 million children and adults have diabetes. That's already close to 10% of our population. Undiagnosed, 7 million. Pre-diabetes, so that's not even in that 7%, 79 million. Women, 12.6 million, or 10% of all women ages 20 and older, already have diabetes. Why is that important? Well, it's important because it has a lot of clinical consequences. It is the leading cause of blindness in the working-aged patient. 50% of loss of limbs don't come from motor vehicle accidents. They actually come from diabetes. 35% of new cases of end-stage renal disease. So this is not that your numbers are just a little bit funny on your lab work, but you're headed towards dialysis Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Anyone who has a family member or takes dialysis themselves will tell you it's incredibly disruptive, very physically draining and tiring. 2 to 4-fold increase in cardiovascular disease if you have diabetes. For women in particular, diabetes is a problem. If you have diabetes and you have a heart attack, you're much more likely to die as a result of having diabetes, even when it's relatively well controlled. It's a great risk for blindness in the patient population for women. We have a shorter life expectancy if we have diabetes, and often our targets are not aggressively met. And so the American Heart Association, the Diabetes Association have all sort of gotten together to talk about goals for diabetes. And if you've heard of this thing called the hemoglobin A1C, that kind of lets us know how you're doing. If you stick your finger, that tells us how your blood sugar is doing in the last 4 to 6 hours. But this hemoglobin A1C, which is an important number if you're diabetic that you need to follow, tells us how you've been doing over the last 30 to 40 days. So it's like you can run, but you can't hide. So you can starve all you want to the day before, but that won't really change your hemoglobin A1C. We will find out if you're not controlling your blood sugar. And it is an important number. We used to say that the cutoff was 7, but now we're beginning to believe that the cutoff needs to be more like 6.5 in order to decrease the likelihood that you'll go on to have heart disease and stroke. 2050, where will we be as women in the United States? 27 million diabetics, and 2/3 of them are going to be less than 75 years old. So we talked about blood pressure, diabetes, cholesterol. We haven't talked about smoking, but there isn't such a thing as a low-dose smoking. There's just none or smoking. And so the recommendation is complete quit of smoking or cessation of smoking. Here's why these things are important. If you look at column A, that's a patient who has good blood pressure, good cholesterol, good happy cholesterol, or the good cholesterol, HDL, no diabetes and no smoking. If you're 55 years old, you still have about a 5% chance of having a heart attack in the next 10 years. But if you add these risk factors and you get down to D, and you have high blood pressure, your cholesterol is high, your HDL is too low for a woman because it needs to be 50, you have diabetes and you smoke, and some people are always going, well, nobody, that's like the imaginary patient. That is my most typical patient. That's not the imaginary patient. That's the one I see most often because I'm an ICU doctor. And so when you get that sick that you need to be in the critical care unit, often you have this many symptoms. If you're in column D and you're looking at this board right now, when you're 55 years old, you're going to have more than a 25% likelihood of having a major heart event before you get to be 65 years old. Body mass index, my least favorite topic. And so this is a picture of my family several years ago at the National Black Theater Festival. I am the woman in the orange dress. I was close to 300 pounds at the time, and I was desperate to lose weight. I was trying everything, and people often ask me, what set me on that journey? And the lady sitting down was my mother and my grandmother. They were the most important people in my life. And I was worried. I wasn't feeling good. And I had a sense, based on the statistics, that I might not live past my mother and my grandmother. So I went to go get some insurance, and they denied me. My cholesterol was high, my weight was high, and I was not a candidate for insurance to take care of my family. That's what really got me started. And I tried everything, shots, pills, surgery. I won't name names, but all those things that go in the mail, okay? I don't want to say that any of them are bad. Some of them are good, but there is probably nothing that I haven't tried to lose weight. I even tried to have it scrubbed off. Went to a spa, and they said, this is going to be pretty messy, so you can't wear any of your clothes, so we have special bottoms for you. And at nearly 300 pounds, they gave me a packet this size. And in that packet was the spa panty. So I prayed that it was going to be like that thing. Have you ever seen the t-shirt where it wets, you wet it and it gets bigger? Or the towel, you wet it and it suddenly is 3 times the size? No. This was the spa panty. At 300 pounds, this was the thing that set me on my journey to losing weight. There is no graceful way to wear this thing at 300 pounds. So now I'm embarrassed where I go. I can't get insurance. I can't take care of my family, and I'm not even 35 years old. That was a crisis in my life. And I'm hoping that when I tour around and I talk to people that they don't have to get to the crisis before they start to address this. For African American women in particular, weight is an issue. It is the reason why we have more diabetes often. It is often the reason why we have more high blood pressure. Body mass index is basically how tall and how big you're allowed to be. So you can't see that, and I know, because it's a very small chart. You'll need to look at this when you go to the doctor's office. But here's an example. The average woman is about 5'5" or 5'6". So the American Heart Association recommends that if you're 5'5", you need to be between 115 pounds and 145 pounds to be normal. That's where the crowd starts really fidgeting in their seats. You're considered overweight if you're 150 to 175. You're considered obese if you're 175 to 240. And if you're like me when I was in that orange dress, you're considered morbidly obese and at great risk for heart attack and stroke if you are greater than 240 pounds. Most Americans are either overweight or obese. Almost 2/3 of American children and adults do not make this cut. An alarming statistic, 25% of men in America between the ages of 18 and 30 cannot join the military if they want to because they cannot meet the age requirement or the weight requirement. What will happen by the time we get to 2050 is that we will not be able to staff our fire departments, our police departments, and our militaries because America will have exceeded the weight limits and the capacity, the health capacity, to do those jobs of service. It is an epidemic, it is an emergency, and you are very lucky to be a part of a church that takes the time to begin to focus on that. Earlier I said there were some sad things that I've heard, but the number one saddest thing that I have heard since I have been a doctor, in 1997 I graduated. This generation of children, the first generation of children in the history of America, will most likely die before their parents. The first generation in America of children that will most likely die before their parents. Most of it has to do with obesity in this country. So adult onset diabetes is supposed to happen when? When you're an adult, not when you're 10 or 8 years old. Adult onset high blood pressure, not supposed to happen when you're 8 and 10 years old. We have children in this county who have to go to the nurse's office, and now we don't have nurses in schools all the time, so sometimes the parents have to go all day long to give these kids their sugar medicine and their blood pressure medicine because they can't get through the day without having a blood sugar spell because they already have adult onset diabetes. But there's something else that's pretty interesting. So the gift of life. This doesn't just begin because we feed our children once they're born. And so what happens is, there was a recent study to show that women who overate during pregnancy were much more likely to have an obese 8-year-old than women who ate well during pregnancy. So you begin to give your child the gift of life, or take the gift of life away from your child even before it takes its first breath. And so if you are expecting, try to make your body as healthy as possible. Choose the right foods to eat. Partner with your OBGYN. As African American women, we're much more likely to have low birth children. We're much more likely to have premature deliveries. We're much more likely to lose our children after birth. Much of it can be prevented based on having prenatal care and taking care of the things that we put in our bodies. So I'm going to warn you, the next picture is alarming. Gestational diabetes, that basically means pregnancy diabetes. Who's at risk for that? And so if you've had a pregnancy where you had diabetes during pregnancy before, you're much more at risk for it. And here's what people don't always know. If you have diabetes during your pregnancy, it's not just a thing that goes away with pregnancy. You are much more likely to have diabetes later in life than someone who didn't have diabetes during pregnancy. If you had a baby that weighed over 9 pounds and no one actually talked to you about gestational diabetes, I would be concerned because that is a possible risk factor for gestational diabetes. If you're over 25, so it's not advanced maternal age, 45 years old, just being over 25 makes you at risk. A family history of diabetes. Starting your pregnancy overweight or obese. Well, most of American women are overweight or obese even in their young ages. So that's the majority of pregnancies that are going to be at risk for having sugar during their pregnancies. If you're African American or belong to other ethnic groups, you could be at increased risk. And if you're trying to deliver or carry a pregnancy while under the treatment of HIV, you're also at extreme risk for gestational diabetes. So I can tell you I grew up with a grandmother that smoked. I only got one spanking my entire life, and it was when I flushed the cigarettes down the toilet. But smoking could kill her, and I tried my best to flush them down the toilet, and she ultimately had a massive heart attack at 67 years old, and that was the thing that got her to quit. But she was making that decision for herself. When you're pregnant and you're smoking, you're making that decision for somebody else. And that's a very, very important thing to remember. So I said we weren't going to do a lot of talking about babies, breasts, and bones because we really want to have a revolutionary look at women's health. But it is important to understand what is unique about us and to talk about it. So the North Carolina statistics are getting better. Infants are not dying as often in North Carolina at birth. The rates are higher for African Americans than it is for our Caucasian counterparts, but in both categories across the state, the numbers are decreasing. So when I first saw this number, I thought, that's wonderful. But then you begin to look at the map and you realize that in Forsyth County and some of the counties close to us, our numbers are not particularly good. And then when we look at the statistic in Forsyth County itself, despite the fact that the numbers are somewhat improving, African American women are still 3 times more likely to lose their infant after birth than their white counterparts. Breast cancer is the most common cancer in women. The numbers are also going down, which is a good thing. The challenge is that African American women are not experiencing that same good outcome. So if I am meeting with an African American woman that was just diagnosed with breast cancer, the unfortunate truth is that she is much less likely to survive the next 5 years than her Caucasian counterparts. And so the numbers of breast cancer are going up, but we're getting earlier detection, but it's getting more and more confusing for women. And so we need to talk about our experience and then try to figure out a way to make it less confusing. So early in life, African American women begin to have breast cancer between 35 and 45 and earlier, very different from our counterparts in other ethnic and racial groups. In every age category, it is true that African American women are at higher risk for developing breast cancer than our cohorts. Mortality is higher, we talked about that. So early diagnosis is important. It increases the likelihood we can survive. You can take less toxic treatments potentially, and you have a better chance of preserving breast tissue. If it starts to infiltrate the whole breast, then typically there aren't very many options for preservation of the breast. But it's confusing out there. Lots of people are chiming in on when we're supposed to have a mammogram, when we're not supposed to have a mammogram. So the U.S. Preventive Services Task Force said that they weren't even sure there should be routine mammograms between the age of 40 and 49. And then they gave other recommendations that really started to worry me, particularly in the African American patient population, because we're at such high risk. When we look at the Cancer Society's recommendations, it says mammograms yearly after age 40, as long as someone is in good health, and not just for high-risk women, but for all women. Clinical breast exams every 3 years until 40, and then yearly afterwards. And then the self-breast exam. The reason why people are saying that they want to move away from the self-breast exam is that most women haven't been taught correctly how to do it. And so if you're with your doctor and you want to monitor yourself, you have to be sure that you know exactly how to do it. It's not just the breast tissue, but it's the tissue underneath the arm. It's not just the breast tissue underneath, but actually all the way up to the top part of the chest. They have to show you how to make small steps around the breast in order to be able to detect breast cancer. But that is not the substitute for mammography, because even if you've learned how to do it properly, you could still potentially miss something that can be picked up with a radiographic picture. The truth about screening is experts still just don't understand it. There's a lot that we still need to learn about breast cancer, which is why I'm still buying the yogurt with the pink ribbon. But what we know is that there are cancers that are hard to detect, and that in women, if we get cancer, black women in particular, if we get cancer, they tend to be much more invasive in the breast. Osteoporosis, so weakness of the bone. 10 million Americans have weakness of the bone. But predominantly, those Americans experiencing that are women. And there's a disproportionate number of women that wind up breaking bones during the course of their lives, which is really, it's hard to describe. As doctors, we say, when you break the hip, you start circling the drain. It's almost like that mobility changes, your ability to move around changes, and women break their hips and they do fine, but many women don't, particularly when they're senior. So we talked about breast cancer and heart attack and stroke, and it seemed like huge numbers, but if you put it up there with osteoporosis, even though osteoporosis isn't deadly like stroke and heart attack, look at the numbers that women experience in terms of weakness of their bone, and then as a result, at risk for fracture. I always get asked the question, how often do I get my bone scanned? How much calcium do I need to take? How much vitamin D do I need to take? There is not a cookbook recipe for this. It really does depend on you. So the first scan of the bone that you get, depending on how strong the bone is, it may be recommended that you get annual bone scans or every 10 to 15 years. So you can't read an article that says it's okay to get it every 10 to 15 years and sign up for that, because that may not be you. So you'll need to talk with the doctor about that. So there is such a thing as too much of a good thing. You could take too much calcium. I have a lot of patients that think if 1 is good, 2 is better, 3 must be great. So there's possibly harm to it. We get a lot of calcium according to the studies. We get a lot of calcium in our diet. About 800 to 1,200 milligrams total daily intake is probably reasonable. So you rarely need to take 600 milligrams according to the studies, but remember what I told you. The studies don't always include African American women, so put that in the back of your mind. Vitamin D, so it's important to know that not all vitamins are good for you. In fact, there are some vitamins that we call fat-soluble vitamins, where you can actually have a toxicity or an overdose of vitamins. D, A, K, and E. So as you're getting lab work done, it's funny now, it seems like, I don't know, we're playing too much PlayStation or something, but all Americans seem to be vitamin D deficient these days. Everybody's getting back this lab work about being vitamin D deficient, and it's very worrisome for women who are at risk for having weak bones to begin with. So it's very important to know a few things. The literature really hasn't panned out that taking lots of vitamin D is the appropriate thing to do. 1, because it can be toxic. 2, because when you buy it over the counter, you're not exactly sure what you're getting. A lot of these herbal remedies don't go through the FDA, the Food and Drug Administration, and so it says that the capsule has X amount of milligrams in it, but it hasn't really been tested. So you don't know what you're getting in that supplement. It may be 1,000, it may be 10,000, you're not quite sure. And then the other thing is that it seems to be safe to take about 1,000 to 2,000, assuming you know what you're getting. And so a lot of times patients develop toxicity because they think they know what's in that pill, but it isn't exactly what they think is in the pill. For patients who are older, who tend to be falling more, they're very fall prone, vitamin D is probably an important supplementation for them, something to partner with the doctor on. Now, remember I said we don't get tested a lot in this research, so they can say everybody eats this, and it seems like, but we don't get we're not included in that everybody. So it's important to know that most African American women, actually this is one of the few things where we're maybe a little bit ahead of the game in terms of our colleagues, are a little bit less risk of getting osteoporosis than our colleagues. But unfortunately, it goes underdiagnosed and unrecognized in us. So as we mature in age, the likelihood that we'll have a hip fracture actually doubles every 7 years that we mature in age. The challenge is, even though we're less likely to have osteoporosis, we're much more likely to have a hip fracture and die after that hip fracture if we have it. And then there are population things that are unique to us, sickle cell, lupus, that happens more in the African American patient population, and as a result, it can cause osteoporosis. And then what's interesting is you get a lot of these reports that say, well, the average American eats this much calcium, but we're not the average in Americans. For the most part, we consume about 50% less calcium than the average American person that you read about in these research trials. So it's critical that we know that those studies may not necessarily apply to us. And then as we mature in age, it can be as many as about 75% of African Americans are lactose intolerant. So they don't feel good after they eat milk products or dairy products, and as a result, they decrease their intake. And as a result, then, they decrease their calcium. For women, that becomes critical in terms of bone health. Talk a little bit about the overall health. And so I always talk, you know, when you're little, you hear the hip bone's connected to the thigh bone. There's that little story that you hear about. Well, your mental health is very much connected to who you are and how you feel, how you take your medicine, the illnesses that you present with. And so depression has been linked to thinner bones in postmenopausal women. It's been linked to having mortality after heart attack. So if you go into a heart attack more depressed than your counterpart, you're much more likely to not come out of that alive as a result of the interconnection of the chemistry in your body around depression. Girls born at a low birth rate are much more likely to have depression. So as African American women, we're more likely to have low birth children, and then they're more likely to go on to develop depression over time. And then stress hormones, the things that dump into our systems when we're under stress and we're nervous. Women do not seem to rally as well around stress hormones and have adaptive behaviors in their system. So when we look at depression overall, women are much more likely to have depression. As you mature in age, you're much more likely to have depression, and then African Americans are much more likely to have depression. But in our community, we're also much more likely to not share it and talk about it and accept it. In terms of mental illness, it's one of those things that we tend to shy away from in terms of conversation in our community. And it's one of the things that can affect your overall health. And so it's something that we need to start to be more aware of and more supportive of when patients have mental illness in our community. So how do you know you're depressed? Hard to know, because if you look at this list, it kind of sounds like an average day for most people. So you're a little bit agitated, a little bit restless, you're a little bit irritable, the kids haven't done what you wanted them to do, you know, you have a dramatic change in your appetite because you're stressed, you're very tired, you can't think, you feel hopeless sometimes. These are things that, you know, can happen every day. I mean, people feel these every day, but when they're overwhelming and they happen all the time, they're just unrelenting, they can't seem to let up, that's when you want to explore talking to someone about your symptoms. Psychological distress. So for women in particular, the more distressed they are, the less likely they are to go to the doctor, and that's when they're supposed to go to the doctor. They're more likely to need to see their doctors. Juggling multiple things at a time, we're very proud of ourselves when we say we're multitaskers as women. But being multitaskers actually put us at high risk for potentially not pursuing medical care that we need. And then moms, if you've heard of postpartum depression, post-delivery depression. Moms are very high risk for having postpartum depression, but what winds up happening is a third never get care, and then another group won't get care, or they'll get just a little bit of care, but then they stop because they have to go back to their busy lives, so they get incomplete care. And so it was once thought that it was because they didn't have insurance, but it turns out that 80% of moms actually have insurance. So it isn't because of access, it really is because of trying to just create that preserve, that time for you to be sure that you address your mental needs. Domestic violence, this is the thing that hurts my heart the most. And my grandmother used to listen to country music. And anybody hear Kenny Rogers? Yeah, so he has this song that says, he's sitting at the poker table, you gotta know when to hold them, you gotta know when to fold them, you gotta know when to walk away, and you gotta know when to run. But women often hold them. They think it's a failure if they fold them. They don't want anybody to see them walking away, and they rarely run. And so this statistic winds up being exponentially high. 1.5 million women are physically abused by intimate partners every year, number that's incredibly high. Approximately 1 in 4 women seeking care in emergency departments are because of domestic violence, but they don't walk in and say, my husband beats me or my boyfriend beats me. They walk in and say, I fell down the steps, or I have a sore throat. They don't even talk about something that's hurt. And by accident, we take an x-ray, we catch the fracture, because they'll say, oh, I think it's a muscle spasm. And so they don't even share with us in the emergency department, partly because they're embarrassed, but mostly because they're afraid. They're afraid that they're not going to find a safe haven from the person who's abusing them. And then what winds up happening is they become more depressed. They're often at risk for substance abuse. And unfortunately, both girls are being beaten by their partners and boys, or girls and women. So one of the reasons why those teenage girls are trying to commit suicide more often is because they're in partnerships that they can't get away from, and they're either verbally or physically abusive. It's expensive. I went to the United Nations in March, and the whole entire 2 weeks talked about violence against women. The economy is devastated when women don't go to work, when women have to go to the healthcare system repeatedly to get very expensive care in order to heal and get better from their domestic violence. And so what often happens is long after the violence has occurred, women are still much more likely to have medical problems than their counterparts that were never injured in a domestic violence situation before. The problem is that it doesn't just end when you're young. And this is the category that is most often missed. You think about people sort of mellowing as they get older. They're in the winter of their lives. That's when it's to be the most peaceful. But women who are 65 years and older are at great risk for domestic violence, either because their children are harming them or injuring them, or because of their intimate partners. That's all women. And then when we specifically look at African American women, the violence that we can experience from our intimate partners can be 35 times higher than our white counterparts, and 22 times more likely than we see in other circumstances. So one of the things that we want to do at the Maya Angelou Center is be sure that you live well and you live long. Some of it is just gathering information, knowing where the resources are to get that information. How many of you saw the City Go aubergine last week? So purple. So one of the things that the Maya Angelou Center has done is we've taken on obesity as our challenge because it is connected very much to high blood pressure and diabetes. And so we partnered with corporations around the city to start to highlight the fact that we need to do something so that we can have firemen and police officers in the military. And so we colored the town to bring attention to the fact that obesity is one of our #1 problems in our community. We've created a website called Bright Ideas for Wellness in Women. And I want you to Google it and go to it. It's where you go to share ideas. What I've learned over time is that when you create programs for people without including them, they do not work. And so nothing about me without me is sort of our mantra. We want to be sure that we include women and men in the community to come up with bright ideas about how we attack this problem, because we've had public service announcements, we've had all sorts of things, but we haven't moved that needle on this problem. And so part of it is because we haven't included the community to begin to attack it. So I invite all of you to come online and tell us the good ideas that you've had. Be sure that you can watch your ideas sort of percolate to the top. People will comment on them. What we have committed to do at the Maya Angelou Women's Health and Wellness Center is take those ideas that are important to the community and to begin to build programs to address the challenge that we have around obesity, particularly for women. And so we believe, and Dr. Angelou described her center as being a gift for all women. And what we wanted to do was make sure that there were unique clinics that addressed the needs for all women. And so some of you are sitting on chairs that have little heart cards on them. So if you peek underneath your chairs, you'll see little heart cards underneath your heart cards. And so some of you are women with hearts in your hands, some of you are men with hearts in your hands. If you are men, I want you to commit today to finding one woman that you really want to be sure you can sow into her life, to give her the opportunity to be healthy. If you're a woman and you have the heart in your hand, then listen very carefully, because there's a number of ways that you may be able to do this. We have a women's midlife center. Midlife, I'm not there yet. I don't plan on getting there for another 30 years. But midlife apparently is a terrible place to go. That's what my mother told me, that's what my grandmother told me, but it doesn't have to be. There are ways to feel better through the midlife for women, and we've created a center that particularly addresses the very unique, sometimes challenging needs of women who are entering the middle of their lives and having hormonal changes. And for those of you who don't have hearts, you want to write down this number, 277-1880. If you know someone or you feel like that this would be a good place for you to start to understand how to have a healthy, happy midlife, this would be the center for you. We also have high-risk assessment. I can tell you that Sandra says you all look beautiful, and you do. But even beautiful people have risks. And I've been told that people have gone there and they've been really surprised to know how many risks they have. People will say, I don't have high blood pressure, I don't have diabetes, I eat well, all I eat is carrots. If you were here last year, there was a woman, all she ate was organic, carrots, celery, and she had high blood pressure, because sometimes it runs in families and it doesn't matter what you do, it's just a part of who you are and your genes. You need to understand what your risks are, because the time clock is ticking, an important clinic for you to go to. Wellness coaching. I wish you could have seen that PSA, because it just looked like the average woman. She's running around the kitchen, she's trying to get the kids off to school, she's trying to organize herself, she's trying to get dressed for her work, and she is just sweating. That seems like the average day in my life. And one of the things that we wanted to do was to create a place where you could begin to sort of organize your thoughts. How do I prioritize all of these things so that I can be healthier in my life, healthier in my organization, and cut out little time for myself to preserve a little bit for me, because it doesn't matter if you're cutting that bread just perfectly. You know, it's funny because Dad can cut the bread, and it's just not right for some of these kids, right? Mom has to cut the bread. Mom has to do all these things. And sometimes it's not the kids saying that, it's mom saying that. And that dad would be just fine cutting the bread sometimes, but they won't do that. So I think it's important to go to a clinic that helps you to try to figure out how to manage the stresses of your life. Bone density, we talked about that. Just about everyone in the room, as you mature in age as women, are at very high risk for that. And then the heart clinic, probably the most important of all, because it is the #1 killer for women. And so if you have that heart, if you don't have that heart, please take time to go and have your heart checked out. As much as I love being a doctor, and as much as I love taking care of patients, and I will take care of you if you come, I would rather see you here next year than see you here during the year in the intensive care unit. And then the last little piece of happiness and recipe in my life. About a year and 8 months ago, I sprinkled the most important ingredient that I just know has made my life better. I feel happier and healthier and loved every day, and it's because of my husband. So I wish you happiness, I wish you health, I wish you spiritual development, and you're in the right place for that. Boy, I tell you what, that 20 minutes of being here, I feel like I got my booster shot. I'm ready to go back and tackle all of heart disease in America. And so we're going to have a women's summit in October, and we'll send you information through your bishop to let you know when the final arrangements have been made. I hope you will all come. This is just the tip of the iceberg on a ton of topics. It'll be 2.5 days where we really dive deep and get to know more about each other. And we didn't even talk about women outside of our borders. But their experience is incredibly different. They're sicker, they're more desperate, they're more economically estranged from the men in their communities, and it'll be important to get together and talk about that then. Thank you.